This is Brennan Marilla. I am the Chief Commercial and Operating Officer for OSSIO, and I have the pleasure of talking to Dr. Amber Shane today. Dr. Shane is the Department Chair of the Advent Health System, Department Chair of Podiatric Surgery in Orlando, Florida, and she's part of a very busy and successful private practice at the Orlando Foot and Ankle Clinic. Welcome, Dr. Shane.
Thank you. Thanks for having me.
Yeah. Well, first, I just wanted to ask you how this pandemic is affecting you both personally and professionally.
Sure. This is a situation that no one was prepared for and no one's accustomed to. So we're all having to face it head on and figure out new ways to adjust both personally and professionally. So from the professional standpoint, we are no longer doing elective surgeries anymore. Those have been canceled now through a minimum of mid-May, depending on state. Ours is around May 11th in our state. So obviously we have a bunch of elective surgeries we had scheduled out there that are no longer able to be performed for these patients. So first, taking care of that has been a big challenge. We are still doing urgent and emergent cases. I do take ER calls, so I have kept fairly busy with some fractures and infections that have come through. From a patient in the office standpoint, we are still seeing patients that need to be seen. Obviously, our numbers are significantly lower with that. A lot of the precautions that we have been taking in the office are, we are wearing masks in the office. We have a new cleaning and sterilizing protocol for our treatment rooms, the treatment beds that they're sitting on while they're in the room, and making sure that is effectively cleaned before bringing back patients. So it does slow the process down a bit. We are keeping our waiting room separated, having people in the hallways, or simply just having people wait in the car who would like to wait in the car, and then we let them know when the time is ready for them to be able to come in the treatment room. So seeing a lot less patients, but still here a lot of hours, just because the process of seeing patients both in the hospital and in the office has really slowed down tremendously, because even when you are at surgery, there's effectively amount of time where the respiratory droplets can stay airborne, and so people have to clear the room. There has to be an extended time between when the patient is intubated and when staff and faculty and surgeon can come back in the room to perform the surgery. The same occurs after the patient is woken up, before you're able to take the patient out and before you're able to bring another patient in. So it's extended the process of surgery itself tremendously, as well as it's extended the process of seeing patients in the office in order to keep everybody safe.
How are you managing the business of your practice?
Right. We're actually very fortunate. None of our staff has been let go. Several of them have less hours, but nobody's as low as part-time, or nobody's been let go. They're still all full-time status, and they may not quite be getting 40 hours. We've given our staff the option, since school's closed and a lot of people have young children, we've given them options to take some time off and be home. So we have currently 17 staff members in our large practice who are out either from feeling ill or wanting to stay home with their children, or just feeling concerned being in the office. Right. So we're actually practically understaffed. So we kind of gave the staff an option as to who wants to come to work and who doesn't. And then we've been able to maintain enough hours for our full-time staff that way.
In terms of how you're managing your patients, I would imagine you're doing probably some remote video calls, some telemedicine. Any tips or tricks and in terms of how you're doing your patient consults that way? And are there any kind of tools that you're using that you would recommend?
Yeah, so we are using Ring Central Meeting as our platform for telemedicine, and we have been doing telemedicine the last couple of weeks. I know there's been some extensive research done on whether they're paying or not for this telemedicine. As long as you're using the video conferencing and use the right modifier codes, they are paying the regular office visit as if they were in the office. There's just certain wording and verbiage that needs to go into the note for these types of patients that you're seeing telemedicine. Little tips and things that I've come up with is, number one, I have someone contact them to make sure that they have the capability either on a smartphone or video conferencing on the computer to do this. Some of the older patients have trouble either downloading apps or video conferencing. So first we have a staff member really sit down with them on the phone and make sure they have this ability. And then they walk them through downloading the Ring Central Meeting app ahead of time. And they're emailed a code and a link to click onto. And what I found through the telemedicine is with the video, I actually have had them, hold it up to their foot so I can see what it looks like. I've had them push on specific spots to me that would be key indicators of a problem that they're having. It is obviously challenging and different from being in the office. You have to have more patience with it because it takes a little bit longer to make sure they've clicked on the right video button,
Right.
and to get everything going with speaking with the patient. It's not as easy as just putting them in a room and speaking with them. So it does take some time to get used to and get up and going. I use a staff member to get on the phone with them initially so they can make sure they've updated their medications, their past medical history, go through the note just like they would regularly bring a patient back, update all their medical information, meds, allergies, everything before I get on the phone with them and make sure everything's going smoothly with the video.
Has this situation caused you to rethink at all how you manage your practice, and are there any permanent changes that you would make as a result of it?
Hopefully we don't get all too comfortable, myself and my staff, seeing a lot less number of patients because, sometimes you get in the groove of being so busy, and you get those efficiencies down from when you have a lot of patients, and then when you have less patients, I hope everybody remembers how to go back to moving fast again in the
Right.
office. I think just from a management of patient standpoint of making sure everything is sterilized and clean, and not that it wasn't done before, but it really would be helpful for continuation during flu season and potential future COVID outbreaks to continue some of these just sterility processes moving forward.
What advice do you have, or lessons or key insights do you have for your peers that are experiencing the same thing that we're all experiencing right now?
Well, it's just take it one day at a time and try to be there as much for the patients and your staff as possible, because they're going through the same thing as well too, and trying to just from an emotional, personal standpoint, just really taking it easy on the staff and making sure that you're really thanking them for being there, the ones that are still working in your practice, and that they're being safe in that manner. And it's very helpful for you to have your main key staff members still there and thanking them for this. And then just really taking, what you can and seeing what you can and being available to your patients, either via telemedicine or in your office, and just trying to take safety precautions as much as possible. It's a fine balance between trying to keep your business open, take care of your patients, and then stay safe for you and your patients and your staff at the same time. So it's a hard management, and just remembering to take care of your mental health, eating right, exercising. It's a trying time, and the more we exercise during this time, the better for your mental health as well.
Yeah, good point. How will you tackle the backlog of cases that are building when you return to elective surgeries?
So the hope and the goal through this is that the elective surgeries that were prior scheduled and canceled, that those people will still come back. So we will still see those cases done and that revenue go out there. That's the goal and the hope. We have an ongoing log right now in order of priority and in order of date when they were originally scheduled. And as soon as we have the go ahead, we will start going down that list and just scheduling as many people as possible. And the hope is that people will still be coming in, because not only do we not have those surgeries that were supposed to be performed, we don't really have the new people coming in for the non-urgent injuries, that they're not coming in as much, or we're not booking and scheduling as much. If I have somebody who's coming in now and they want surgery, or they're thinking about surgery, and it's something simple, that like a hammer toe or a bunion that doesn't need to go urgently, then I still, right now, I get their information down, so I have that to hang on to, and we'll give them a call as soon as the time comes when we can start scheduling them again.
What can companies like OSSIO do to support surgeons, and in particular the OSSIO fiber technology? How can we make a difference when the world kind of starts to get back to semi-normal here?
Well, I mean, I'd take those in two facets right now. What you can do right now is education, things like you're doing. I mean, this is a time where we're not getting hands-on education, but many companies and many surgeons are still doing academic lectures. I have 3 scheduled academic video lectures coming up to residents and peers out there. So still doing something from an educational standpoint, even if it's educating consumers, educating the patients on options that are out there for them, and educating the surgeons on the newer technology like the OSSIO, which is a newer technology to give surgeons and patients an option to have non-metal inside their body. And this newer technology is going to be taking off further and further into the future because it does give us an option. I have seen a lot of metal allergies, metal backing out problems with that, and it's very exciting having an alternative to this.
Final question is, what have you learned about yourself during this stay-at-home period so far?
Well, I guess I knew this already, but I'm a really scheduled person. So and I like to plan, and I'm a planner. So the openness about when this is over and when you can go somewhere and when you can go back to normalcy is a harder thing for type A busy personality like myself to actually accept. So I guess that's something I've learned about myself. And I've also realized that sometimes when you're in a situation like this, you know, the crisis part to it, you just have to sometimes step away from it, not watch the news anymore, which plays everything out very dramatically, and just exercise and step away. So exercise has been my big key to this time. I've exercised more during this time. I love to exercise, but I don't always have time for it between hours and hours of patients and meetings, and then trying to see my children at home. So family biking and doing online workouts has been my sanctuary away from the COVID virus. And I've also learned that I never thought I would homeschool my children, and I never will homeschool them in the future. That's been the biggest challenge through this, is having the poor kids at home to try to be homeschooled at the same time as you're trying to manage practice as well is very challenging.
Well, Dr. Shane, thank you so much. That was really it's very generous of you to share your insights, and I think some great advice and some great messages there for everybody. Thank you so much, and stay healthy and stay safe, and hope to see you soon.
Great. Thanks so much, Brennan. You as well, too. Thanks for doing this.
Yep.